Hi, it's Noel Williams, Dr. Noel Williams, for those of you who don't know me. I'm going to address the state question that's coming up Tuesday for Oklahoma, and that's on legalization of medical or medicinal marijuana. I'm going to start by saying, absolutely, positively, do I recommend voting for it. Before anyone gets upset, I want you to listen to the whole paragraph, which is more of an essay on why legalization ultimately is a good idea. But first, I'm going to explain some things about marijuana or CBD. CBD is cannabidiol. That comes from hemp, not the marijuana plant. The marijuana plant has tetrahydrocannabinol in it, which is slightly different. And that's what causes hallucinogenic properties. So if we think about the history of CBD, which is the medical portion, and THC, which is the hallucinogenic portion, the histories are vastly different. The key concept to know is that CBD has a multiplicity of major medical uses and benefits. These include all things from inflammation, neurologic irritability, so seizure disorder, neuropathic pain, neuropathy, migraine, the list goes on and on, anxiety, some versions of depression, anger management, and then from there it goes into immunology, and there's really a litany of things that CBD addresses. CBD we get currently, which we have in our practice and many practices and communities in Oklahoma have, ultimately comes from the hemp plant. The hemp plant is 0.3% THC. So when the product is originally produced, it comes out as 0.3% THC, and then the rest is CBD. By the time it gets into our hands, it's 100% CBD. So if we look at a bottle of CBD like we carry in our office, a 1 ounce bottle has 1,000 milligrams of CBD and about 300 milligrams of other associated cannabidiols. If you take a step back though, where did that come from? The product above it would be a 0.3% THC product, which has no hallucinogenic properties whatsoever. But that product will have 6,000 to 7,000 milligrams of CBD, and then another 2,000 to 3,000 of the associated other types of CBD or related molecules. So what happens is when we purify out the 0.3 THC, we lose 80% of the CBD, which is the whole medicinal, or not the whole, but the vast majority of the medicinal benefit. That then in turn causes price point differences because it takes $2,000 to make a kilogram of 0.3% THC with CBD. It takes $19,000 to get it to our product, which is 100% CBD. The ultrafiltration process is very expensive. So the first concept with legalization is 0.3 THC is legal for medicinal use in the state. That is going to take care of 80% plus of issues that CBD or quote unquote medical marijuana addresses. But let's go beyond that. There are some patients where the CBD alone with just a little bit of or CBD with a little bit of THC isn't sufficient. So if you have patients with neuropathic pain, sometimes refractory melancholic depression, severe inflammation, cancer patients, going to a 1 to 2% THC product actually can make the CBD work better in that group. So for about 10% or so of patients, that 1% to 2% THC is super important to get the medical benefit. So let's go next to, well, what about higher amounts of THC? Does it have medical benefit? I hear a lot of people talking about medical marijuana and THC and most people don't really know anything about what they're talking about. THC does have, at higher concentrations, does have medicinal benefit, but it's particularly humorous to me because it's mostly for gynecological and sexual health, which is what I spend all of my time doing, because as THC content goes up, things happen in the liver. And those things that happen in the liver have to do with protein production. And so when someone imbibes a higher THC product, like a 20-30% THC product, there's a change in testosterone metabolism. That in turn results, and it's a positive change, of increased sex drive for a few hours, increased sexual response, lubrication, orgasm, and potentially erection. So in terms of gynecology or male hormonal health, higher amounts of THC are very, very helpful for difficult sexual dysfunctions. And so it's really useful for that. It also has a role for patients with severe cachexia or anorexia from cancer, and then for people with terminal type cancer pain, the THC proportion going up improves effectiveness. So overall, by having legal marijuana or medical marijuana, we can address a ton of issues that we otherwise can't. I read a study this last week that the minimal impact on pharmaceutical companies, if there's just simple legalization of 0.3 THC to 1% THC in every single state in the country, because of the then availability of better CBD, is going to cost $18 billion in less pharmaceutical spending. And this is the key thing about CBD. CBD fixes things. It's not, for the most part, putting a Band-Aid on something neurologically or for pain. It's actually re-stimulating receptors to go back to normal. So it's actually a solution and not just a cover for a lot of the medical stuff. I hear people talking about, well, this bill isn't written in a way that's completely safe for our society. There may be some truth to that, but every time a bill like this comes through, or rather, if this becomes law, the state legislatures in each state can put the requirements or regulations around the legalization to make it safe. I've then heard that 60 days isn't enough time for the state legislature to do this. Well, let's think about that for a second. I've asked probably 50 to 100 people in the last week, patients, friends, some of my staff, name one thing the state legislature has done in the last 5 years. Besides this teacher thing, which they didn't really do, it really happened to them, no one can name anything. The purpose of the legislature is to actually do something positive for our community. They don't have to reinvent the wheel in Oklahoma. There's Colorado, there's Oregon, there's tons of states that have statutes in place that we could model ours very easily on for immediate adoption to make medical marijuana safe in our environment. It's avoiding responsibility, which is what politicians and legislatures do, is the problem. This is an easy thing to fix. Pass the law, make the legislature do its work, have the governor do her work, and we can have a very safe medical marijuana environment in the state of Oklahoma, help hundreds of thousands of patients, save tens of millions of dollars, lower drug abuse, make sick patients well that otherwise have failed everything. So I would strongly encourage you to vote for legalization of medical marijuana. I know there's some problems with the way the referendum bill was written originally. The legislature can fix it if it has the willpower to do so. So that's my summary on this. I hope I don't offend anyone too much, but science is science. CBD works, period. Anyone who says it hasn't read a thing. Anyone who doesn't understand the role of THC and how it works hasn't read anything, and that's okay. People don't read, doctors don't read. But if you're a science-driven person, everything can be found on PubMed, the national research site. You just have to really work and research and read nerdy articles like I do all the time. So anyway, take care, have a great weekend.